Hi, it's Dr. Daniel from the Neuropathy Clinic at Fix Me. And I wanted to make a very quick and shorter video. I previously covered this, speaking about neuropathy and its incurability. So many of the patients that I speak with and that reach out to me have been told that neuropathy is incurable. And it doesn't matter who you ask, whether you ask your primary care doctor, your neurologist, you can ask ChatGPT, Grok, Claude AI, all the engines, Google, they're all going to tell you the same thing, that neuropathy is incurable. Now, I obviously understand that's not to be true, but I want to explain where the miscommunication lies. And I'll speak about type 2 diabetes first. I have yet to see a patient, and I've seen hundreds, if not thousands, over the last 20 some years of patients who have diabetes. I've worked with them for ages, even before I started doing neuropathy, who were told by their doctor, their primary care doctor, or even their endocrinologist, hey, we can reverse your type 2 diabetes. Again, that doesn't mean that it can't be done. It's just that it's not done. And there's certainly lots of reasons in terms of why the medical establishment doesn't do it, but it comes down to this. Doctors are told how to treat patients. It is a top-down directive, meaning the administrators in hospital groups explain to doctors, okay, this is how we treat somebody who has diabetes. This is how we treat somebody who has cardiovascular disease. This is how we treat somebody who has neuropathy. And all of those guidelines are set up and established, and it's all based on management of conditions and not solutions. And that's great if you're somebody who experiences an acute stroke. I don't come to me. I'm absolutely not your guy. That's something you need to get, you have the golden hour. You need to get to the emergency room as quickly as possible. They can administer the medications and stop, slow, reduce the side effects associated with that stroke. Now, lifestyle diseases are a completely different animal. And I would say probably 95% of our problems here in the United States stem from lifestyle type diseases. And medicine is just not designed to solve those problems. They're management, so they want to get the numbers better on paper. So somebody comes in and their A1C is, I think the highest I've seen is like 13.7, maybe even higher than that, but 13.7. They're going to get you on the right medications. They're going to possibly do a GLP-1 inhibitor, and they're going to help you get those numbers back into better or more normal ranges. That does nothing to solve the problem, meaning there's still inflammation, there's still damage occurring as a result. And that's, especially in the diabetic realm, that's leading to those patients who develop neuropathy over time because neuropathy is always secondary to inflammation. So what I'm talking about here is all neuropathy is, in the simplest explanation, is the condition where the insulation or the myelin that is protecting the nerve is breaking down more quickly than the body is able to repair it. And again, that is always secondary to inflammation. Now, there are certainly many things that lead to inflammation. Again, diabetes, prediabetes, blood sugar dysregulation, the primary cause of the majority. But I just had a patient that we signed up the other day that their situation was secondary to an anesthesia, which triggered a response, an immune-mediated response in their vasculature, and tick, tick, tick. So again, but it is an inflammatory event. And so when we're talking about tipping the scales for health, if we're talking about how the body heals itself, the body is made to heal itself. And if somebody has neuropathy and has neuropathy that's progressing, what's happened is that the scale, which is healing versus inflammation, has shifted in the wrong direction. So normally we heal very quickly because our inflammation is low. And then as that scale gets shifted, as we age, as we accumulate damage, other things happen. It gets to the point where the inflammation is overwhelming our healing, our natural healing abilities. And that's when breakdowns occur. And the protocol I use, which is the MVN protocol, the metabovascular neuroplasticity protocol, addresses the body systems that will then effectively help shift that balance and start things moving in the right direction. And again, there are no drugs out there that stop or prevent neuropathy from progressing. There are things that can manage symptoms, whether we're talking about gabapentin, duloxetine, pregabalin, Lyrica, even amitriptyline sometimes for pain, the opioids. But again, those are all focusing on managing symptoms and not addressing the root cause, the underlying cause of the problem. And so in the calls, whether it's a discovery call, which is just a quick 5 to 10 minute call with patients, or the full-on one-on-one consultation where we really dig into things and get into deeper discussions about the case, it's all about seeing what's happening, what's driving the inflammation, what can we kind of tease out from what's happening in the situation to determine, hey, this is a case that we can address with the MVM protocol, and specifically what needs to be done in each of those areas so that, again, we can shift that balance so that we're healing more quickly than we're breaking down because of that inflammation. And again, medicine isn't designed to address a lifestyle issue. They are there for acute care, and they do an incredible job about that, whether it's a heart attack or a stroke. Those situations, you absolutely want our medical system. It is second to none as far as those situations are concerned. Patients in a critical acute situation. In the chronic lifestyle situations, that's where the model breaks down, and they need some help because they're not designed to do that kind of, or even think in that way. And that's where I come in. That's my job, is to assist patients, and whether we're reversing the type 2 diabetes, helping patients lose weight, who's going to help reduce the blood pressure. All of those play roles in reverse, well, so number one, halting the progression of neuropathy, but then also reversing it, because at the end of the day, the body is meant to be a self-healing mechanism, and there are many factors that go into shifting that balance, and that's all of the things that would be discussed during a one-on-one consultation, or even very briefly in the discovery call, to make sure that I understand what's happening to the patient, or at least have a decent idea before we can figure out next steps in terms of what is the best course of action for each individual person, because not all cases are alike. Now, they may be similar, but each case has to be taken on its merits, and we have to figure out what's going to be the best fit for each person. Again, I hope that answers that question. And again, hope to see you. If you have questions, you want answers, then that's what I'm here. So all you need to do is click the link below, or follow through on the link that you received from our ad online. And I'd love to speak with you. Okay, talk to you soon.